Everyone is a star child, made of stardust and the infinite potential of the universe. This extraordinary field is something in each of us clamors for freedom from the bonds of fear, conformity, and an ordinary life. Welcome to Dr. Durr's Living in the Sweet Spot, where practical tools and solutions from the intersection of mind-body medicine, science, and spiritual well-being awaken and empower you to live out your infinite potential, to live life in the sweet spot. Hello, everyone. I am your host, Dr. Boan A. Durr. And, I know that as a spiritual being or an energy being, that in order for us to demonstrate our infinite potential, we have to have hands and feet. And in order for us to have hands and feet, we need to then have a brain that operates that hand and feet. So in order to have the greatest demonstration of the infinite potential that we are as star children, that the brain then is what I call the gateway to having that greatest demonstration. And so in order to have that, the healthier your brain, the healthier and the greater are your demonstrations. So today, joining me is my guest, Dr. Gretchen Boules, a psychologist and actually a prescribing psychologist. So I would welcome Dr. Gretchen.
Thank you very much, Dr. Boan. Thank you for having me here today.
Well, you know what? I of course, I'm so happy to have you here and was so looking forward to having this conversation with you because, you're kind of like a unicorn, right?
I
am. And, just to give the audience some background as to why I'm saying that, Dr. Gretchen Boules is a licensed clinical psychologist here in the state of Illinois and for over 25 years. And then she's also an adjunct professor at the Elmhurst College, where she teaches undergraduate sciences. She is the 5th licensed prescribing psychologist in the state of Illinois and the first prescribing psychologist to treat patients at Ascension Community Health Center in Arlington Heights. She's also, again, been in private practice for over 25 years. She's the founder and CEO of Boules Clinical Psychology Group in Burr Ridge. And, again, Dr. Boules is the program manager for the Alexian Brothers Ascension, Illinois Health Systems Prescribing Psychology Fellowship Program. I believe the only one of its kind in terms of of an approved program by the state of Illinois. So that is why I'm calling Dr. Gretchen a unicorn, because there are only, unless it's changed recently.
It has changed.
Right. Well, I was going to say, but there are only like 5 states in the in the U.S. that actually have prescribing psychologists, and then Illinois being one of them. And then there, of course, there are a relatively small number of prescribing psychologists. So, one of the things that I know to be true is a lot of folks are even unaware of the difference between what you do as a psychologist and what I do as a psychiatrist, right?
Right.
And so, of course, I'm a medical doctor. And you have a doctorate in psychology, so you have a PsyD. But why don't you tell us a bit more about what makes you different as a psychologist from me as a psychiatrist?
Okay, so first I was thinking about that before the show, and I thought you're right. I don't think a lot of people know the difference. So I thought I'd give a little historical background on the two. So a psychiatrist is, a medical specialty. And it's been around.
Right. Meaning I went to medical school.
You went to medical school.
Could have been a pediatrician, could have been an oncologist, an OB-GYN. So I'm a medical doctor.
And with that, you are really able to prescribe any medication that you would like because you have gone through all of that training, and you can work with some, medically challenged cases. Um, the psychology route is a little bit different. We really didn't come into being until after World War II, and we started out as sort of the assessment people, and we did a lot of testing, and that's where we started. And it was the 1950s with the Carl Rogers and Albert Ellis and those folks that we started to get into psychotherapy. And then in the 1960s, APA recognized psychopharmacology as a subset discipline of psychology. So, prior to the 2000s, we were doing testing and psychotherapy strictly for mental illness. And you go to school, you go to graduate school after college and get a PsyD or PhD, and you become a psychologist. And then you have to go through licensure and so on. But you're not able to prescribe medications.
Right. So again, just so folks have a little understanding, we've already established I'm a medical professional, but what do you then do as a psychologist?
Yeah, and so back in the 90s, the Department of Defense, it was like 1991 to 1997, they decided to do a pilot project to see if psychologists who were trained could prescribe medication to the Army. So there were 10 psychologists that went through the training, and it was a huge success. So after that, states started to talk about, well, maybe civilian psychologists, particularly with the mental health crisis, maybe if they got enough training, maybe they could do the same thing. So
right, but I think what I'm trying to get at, I think there's a lot of folks that are not even aware what you do as a psychologist, even if you're not a prescribing psychologist.
Okay, so I consider myself a generalist, and so patients come see me if they're anxious or depressed or they have marital problems. I do a consultation with them, and we create a treatment plan, and I see them in therapy. I do a lot of hypnosis, mindfulness. I'm a yogi. I incorporate that into my practice. Yes. So traditional psychotherapy with a little bit of holistic twist.
Okay, and then but psychologists they also do psychological testing.
Right, and so I do testing. I do memory testing for patients. I do personality testing, bariatric evaluations. I do testing for patients prior to surgery. So that's kind of my practice.
Okay. And then the testing then helps you, it helps you kind of figure out maybe
is this person
certain areas, also in certain areas, one, if there's some brain dysfunction.
Right. So you could have someone come in and you might say, gee, they really seem depressed, but it really could be that there's some kind of dementia process going on.
Right.
If I do a screening and I feel like
I'm just to say also, so things like, and again, I'm really trying to tease this out.
Yeah.
I think it's really important that people have an understanding of the real benefits of working with a psychologist and the different tools that you all bring to assist and to assist people in working through whether it's depression, whether it's trauma, whether it's anxiety, whether it's ADHD, whether there's traumatic brain injury, to really kind of tease that out so that they see how hugely beneficial it is, and especially even to have testing, because for instance, if you have problems with remembering things, problems processing things, if there's issues with determining what your IQ is, so
right, it helps the patient because it objectifies what's going on for them, because oftentimes they know there's something wrong, and then you can go back and say, okay, well, the testing is showing
that this specifically is what's happening with your brain, which is just not working properly, and it's creating this problem.
Right. And so therefore, I will send you to the specialist or the specialist, depending on what the nature is of the problem.
So I think
If
I think it's, I always
yeah,
appreciated this as because in obviously when I was in residency, especially, but in medical school too, to some degree, as a psychiatrist, you're trying to figure that out. And so as a psychiatrist, I don't do psychological testing, right? I don't do
right,
neuropsych testing. That's the domain of the psychologist. But again,
right.
as you're saying, it gives us an
The
objective
it's
measure to
yes,
identify this brain dysfunction and then to
right.
formulate a treatment plan that's in keeping with that. Yes, it's in your head, but it's actually literally in your brain, right?
Yeah, and your body, and educating them that yeah, you are feeling things. You can't
Yes.
separate the two. And how do we go forward?
Right. So
And
you have,
and
I'm
go
sorry, go
ahead.
ahead.
So
Go
you
ahead.
go ahead.
So I was going to say, so you have a PsyD, and I know there's a PsyD. Some people have doctorates, but it's not always a PsyD. The PsyD is a doctorate in psychology, right?
Correct. You can get a PhD. Traditionally, the PhD was less clinical,
Okay.
and the PsyD was more clinical.
Okay.
And I did take more of a clinical path. So
Got it. Got it. So okay. So I think now that we've gotten that teased out in terms of, that your doctorate, you went to graduate school,
right.
right? You
Right.
went
So
to
you went to medical school and I went to graduate school, right?
correct, correct. So very, very so very different paths.
Yes.
So you get your side D. What kind of work what kind of work were you doing at the time when before you got into um the training program or
So yeah, when I graduated with my PsyD, I ended up going into a hospital, acute hospital setting for about 10 years.
okay,
And
challenging
and we
work?
were and we were kind of playing with moving around to different. I was working with cardiac rehab and the infertility clinic at McNeil Hospital in Berwyn, and the transitional care unit, and we were sort of, feeling our way in terms of integrating behavioral health with medicine, as it
Okay.
was kind of new back then. But I was playing with these different ways of working with different professionals, and it was successful.
All right. And
Um,
so then tell me how doing that kind of clinical work in those various settings, again, how did your path lead you to doing that study that
to
you mentioned
do
with the
to do
military?
this. Oh, well, I didn't do that study in the military, but
Okay.
that study, I think, came out, that was in the 90s that occurred.
Okay.
And so
And you were only
prior to,
5, right?
yeah, I was 5, but I was not a part of that study. But no, I mean, back then I wasn't really, this was so, gosh, when I started working at that hospital, it was 1992. I was kind of thinking about prescribing, but I really was much more involved with psychotherapy and testing. And I had started my private practice at that time as well. And that's when I was also teaching at Elmhurst. I don't do that anymore. Um, but then I moved into clinical hypnosis. I was really intrigued by that and involved with the Chicago Society, and did end up becoming past president. I finished that in like 2000, but I still do hypnosis and mindfulness and the yoga, and that all I felt like really uh, it was a compliment to what I did as a psychologist. So I knew probably in the, let's say after I got married, so like 2000s, early 2000s, that this was kind of on the horizon, because New Mexico was the first state in 2002. And then 2004 was Louisiana. It was kind of out there, but the psychologist that sort of spearheaded this whole thing in Illinois, she was the president of IPA at the time. Her name was Dr. Beth Reimer. So I would say my discussions with her kind of inspired me to move forward with this. And I remember having an interesting conversation with another psychologist at the time. A lot of psychologists were very much against this and were really concerned that this would change the field of psychology. And he was a mentor of mine, and he said it really doesn't make sense to me that you would consider this, given the fact that you are much more holistic in nature. He said, I don't see those that as meshing. And I said, really, on the contrary. I said, if I want to understand the whole person, wouldn't it behoove me to understand what's going on with the brain? I don't want to be a psychiatrist. I think it's a different field. And since then, he has agreed with me. So I didn't quite know what it would look like, but I jumped into the training about 2 weeks after I had a discussion with Ram Reimer. And so I was 47. I'll be 57 next week. So it's been quite a journey. I had 2 young kids, probably in their middle school, grammar school. My husband was working in Utah. So I was balancing my practice, and I thought, I'm going to go for this. I thought it made sense at the time.
Okay.
So it was 2014 that Illinois passed the law, and I was a little shocked by that because a lot, and there was a lot of lobbying against it too, which I understand. And so when the law passed, it was a much more stringent law than Louisiana or New Mexico. So would you like me to tell you how that looks? And so you have to be, you got to be a clinical.
What it looks like. What does it look like here in Illinois?
In Illinois, you must be a clinical psychologist licensed in Illinois. Then you go on to get your master's in psychopharmacology. So that was 2 years. There are 3 programs. I think there are 4 programs now that offer that. I went to Alliant in California. You also have to take several undergraduate pre-medical courses. So I think there were 9 or 10 of those that I had to do.
Mm-hmm.
If you did them during your undergrad, hallelujah, you didn't have to do them.
So what were some of the classes that you had to go back and take?
Chemistry with labs, microbiology with lab, anatomy, physiology, anatomy and physiology, medical terminology, biology. Am I missing some? Statistics, which I already had. Pathology. I think that covers most of them. So we had to do that. Then you have to pass the national exam.
Mm-hmm.
So that's the next hurdle. And then Illinois requires us to do medical rotations from 14 to 28 months. And those included psychiatry, OBGYN, emergency medicine, family practice, internal medicine, an elective. I chose neurology. Surgery. I did neurosurgery. What am I missing? Geriatrics, pediatrics.
Okay.
Now the Illinois law, it's very clear. We're not allowed to work with anyone under 18 or over 65. No pregnant women, no one with any very severe medical challenges like cancer, heart disease, diabetes, seizure disorders. We are not allowed to prescribe stimulants. So it's very, very specific to a certain population.
Mm-hmm.
And I just had so I was licensed in 2020, and I've had a patient I've been doing psychotherapy with for years, highly anxious, who never wanted to try a medication. And so 2 years ago, I started her on buspirone, very, very low dose. And it's been working well. And next week she turns 65, so I cannot prescribe her anymore. So that's an interesting situation to be in. So I have to refer her out.
Right. Although, at least in her case, because of the medication she's taking, probably a primary care provider could do that.
Right.
With with a level of comfortability. So
Right.
I know obviously at this point in time, number one, not only am I an adult psychiatrist, but I'm a child and adolescent
Okay.
psychiatrist as well. So I'm double boarded. And
Okay.
there's, as you well know, there's a shortage of psychiatrists, but there's a
Yes.
huge shortage of child and adolescent psychiatrists.
And
So
yes, and I think, and I know that we're trying to go back and lift those age restrictions, because the child and adolescent psychologists could certainly work with the younger patients. That's
yeah,
not an avenue I would ever take, because I don't work with that population.
yes. So it was, yeah, one of my Dr. Espinoza, he was actually, because as a physician, again, we do different rotations. And so I was
Right.
doing radiology at what was then the West Side VA. I think it's Jesse Brown now. But Dr. Espinoza, in his wonderful teaching style, he's the chief of radiology. And so I'm doing the rotation, and so talking about what I want to do, and in child and adolescent psychiatry, he's like, "Oh, so you like the little vets?"
Ah,
So I'm like, yeah, I like the little bits.
I could see you working with children. I think that's wonderful. That's a talent in and of itself, for sure.
Uh,
And
it
then you've got the
is,
parents to work with too. It's
yes, it means
can
work, to
be
me, it means
challenging.
working with families, right? It means
Yes.
working with families. But I think it also, if we keep in, as you well know, there are many people, because of either unresolved or unhealed childhood wounds, in terms of childhood experiences, in addition to just, flat out trauma, people that get, and losses, grief, all of that, are really, they're still stuck at some point in childhood. So although I like to say, we're oftentimes dealing with the mind and emotions, of a child or an adolescent in an adult body.
Absolutely.
Right. So, but I'm sorry, you were saying about the fact that in terms of prescribing for your patient who you have on
Yeah,
for anxiety.
right. And most of my patients in my practice,
Mhm.
I do psychotherapy with. And so, and I wouldn't say that I am prescribing to everybody. And I think that was a fear. Oh my God, you give the psychologist a license to prescribe and they're going to go bananas. And it's quite the opposite. It really is. I'm really very tempered and very conservative. And if I, and I think it's important for your audience to know that for those of us who have chosen this path, and incidentally, as of today, there are only 19 of us in the state, and total in all 5 states, maybe 250. So
Okay.
we're
Okay.
not talking big numbers here.
No.
Um, yeah. So, but
Tiny, tiny numbers.
right, compared to like nurse practitioners and PAs, and um, it's a very small number. But we really think it through, and if we think this is a case that is way beyond what we can handle, we refer out. And that's what we do anyway as psychologists. I think that's important to know. We collaborate with primary care and psychiatry and neurology, and it's something that it's our nature. We're very
Yes.
collaborative in nature.
Yes. And I think, and as you were talking, I was also thinking about too, there is overlap in what we do. So while I may be more medically based, I do therapy with my patients as well.
Yes, I
And
can.
so and as you well know, therapists, there's different credentials, as it were.
Right.
So whether you as a psychologist or me as a psychiatrist or someone who's an LSW, licensed clinical social worker, or LCPC, licensed clinical
Uh,
practicing
yeah. Counselor.
counselor, there's different kinds of therapists with different credentials. But again, with you and I, there is overlap. And, for me, um, here's the way I say it. I look at it from a place of mental wealth, with this term I
Yes.
use, mental wealth, that I define as brain health plus transformative thinking. And
Yes.
so it's important to have the right solution for whatever the problem or the issue is. In other words, simple way of saying it is, if you run out of gas, it's not going to help you to put air in the tires,
Right.
right?
And
So,
yeah,
right, you know what
and
I
as
mean?
you're yes, and as you're talking, I'm thinking like how mental health has changed. And so we're calling it kind of like a mental health crisis. I almost think in a sense, more and more people are just uh open to the notion of getting help. I mean, back when I was a kid, if you had problems, you didn't want anybody to know. And it wasn't until you crashed and burned and some horrible things happened.
Right. And I think that's really rooted in the fact that if you think about it, it's really rooted in that if people see you as too different for them and um too unusual, I'm being kind,
Yeah,
because they would just say crazy, right?
right. Yeah,
Um, that if that potentially what it meant was that you got marginalized. People didn't want to be bothered with you. Use this plain simple term. They want to be
right.
bothered with you. They don't want to deal with you. They don't want to interact with you. But then they're also subject to attack you. So the
Yes,
appearance, the appearance of there being something wrong with you, as opposed to I have a brain, so there's something wrong with my brain, is
right.
the fact that I get disconnected and potentially harmed as a consequence, of
Yes,
that. What does this say about me and who I am? I'm weak, I'm not good enough, I'm not this, all these things that it really doesn't mean. It just
right.
needs help. So
It's right. It's an organ in your body that might be dysfunctional, like your heart, like anything else.
correct. And some people, would benefit from, medications, vitamins, minerals, whatever. But then again, if you're if again you need some air in your tires, it's not going to help you put gas in the tank. So if
Right.
a person doesn't need medication, but they don't have the tools to heal their wounds, then that's where any therapist comes in. I mean, I say any therapist, meaning whether it's you as a psychologist or
Sure.
whomever else is providing therapy, is to give a person additional tools.
Right. And understand and helping them the other part of that, I think of going back to that whole dentistry parallel. You go in, you get your tooth is kind of, back in the day, you didn't take care of your mouth. You have a toothache, you go in, they just pull your teeth. Now it's preventative medicine, preventative mental health, preventative brain health. None of us are in the human condition. We can't escape uh, things happening that might cause our mental health to fail us. Teaching people about, their stress thresholds and where they are, and what are your triggers? How do we stay, keep ourselves well on a daily basis?
Yeah. So how do you manage your stress? For instance,
Yes.
keep it in the realm of also, in terms of therapy, because I try to teach people that there's a chemical component to what you think and feel and experience. And
Mm-hmm.
if it's highly stressful, then you get chemicals released in your body like cortisol, which it's fine if it's for a brief period, but over extended periods, what's going to end up happening is it's going to cause damage, right? It's
Right.
going to increase your blood pressure and decrease blood flow and impair your immune system. So all these different things that are happening are going to create illness if it happens chronically over time. So stress killing is a real medical condition.
Yes.
So again, to come back with you and the work that you do, it's really critically important, right?
Right.
So what do you see, um as as well, let's say, what do you see as the benefits of being a therapist, being a prescribing psychologist, for anyone who might benefit from, your unique skill set?
Well, so I'll go back to this anxious patient of mine. She, again, worked with her for years and really lots of panic. Just, couldn't get out of that fight and flight. So in psychotherapy, we did a lot of education about we're changing your neural pathways by talking. It might take a little bit longer. I always wanted her to try medication, and this is back before I could even prescribe. And she was dead set against it. Anxious people are afraid. So the benefit for me helping her is the fact that she knew me for a long time.
Mm-hmm.
And when I finally was able to prescribe, I said, let's just try this really small dose of something. And if it doesn't work, we go off it.
Mm-hmm.
And I'll see you next week. I think I tried her on 5 milligrams of buspirone to take at night. She was terrified. She'd purchased, she picked it up at Walgreens, and she said, I just don't know if I'm going to do it. Finally, she did, and I don't know if it's placebo. Anyway, she's up to 30 milligrams a day and is doing quite well. So the benefit was me being able to work with her on a weekly basis, knowing her for a longer period of time. It was very rewarding.
Yeah, because you have an opportunity to establish relationship and rapport, and therefore trust.
Right. So maybe tops, I see 25 people a week in my practice.
Okay.
Now, up at Ascension at the Community Mental Health Center, they hired me to do just medication management. So that's a real different kind of beast for me. I've got 20 minutes and they just, they don't want me to take any longer time. And I had suggested that maybe I did both the therapy with the med management, and they just wanted me to do med management. So that's been a unique experience.
I'm sure.
Yeah.
I'm sure. So I was gonna say, so let's talk about something I think that's probably pretty obvious, which is, as you said, you're not a physician, you're not a nurse practitioner, you're not a PA or physician assistant, as a non-medical person. And because of the pandemic, and the tremendous stress that it's put on people, and the demand for the services of mental health, one, I also, of course, try to educate, because, from a basic, I think people need to understand that your body can't live without a brain. Right. And so you need to take care of your brain health so that,
yes,
because it's all connected, right? Your brain and your body is inseparable from the rest of your bodies. Like I said, it's not in a separate container.
Yes.
So in that context, again, the healthier your brain is, the better your life is, both in terms of brain function, but also in terms of the thoughts we think. So in terms of what's happened with the pandemic, has that changed, any aspect, either in terms of the amount, the way is there any differences in how that, or how you engage with people, just anything that's happened because of that?
Well, the telehealth obviously became more profound. And I must say, I don't enjoy it. I really want to see someone and experience them in the office. So there are a few patients that I have not seen since, and I just do telehealth with them. Mm-hmm. And I've just had some conversations this week and said, I'd really like to get you back in the office. It's important to see you live at least once in a while. So I would say that I think it's easier for patients. But, so that's kind of the logistics of it. But in terms of just the whole pandemic, I think the stress levels for everybody has just been, especially older teenagers. I do see people 16, 17, 18, college students, older people. It's uh, it's been very profound. Older people who were used to going to church and couldn't go to church anymore. That was their sense of community. Going to the grocery store, just greeting people. They lost all of that, not getting out of their houses. Um, High school kids, and I wasn't working with the younger ones, but you know, having to be with the same small group over and over and over, and that's the time in your life when you're supposed to be exploring new people, and that's how you learn about yourself and within the context of others. I think it caused terrible depression and anxiety, and all kinds of things popped up that normally I don't think would have happened, and I think people are still struggling.
Right. So I think with the kids in particular, and I'm using kids broadly, so whether they're
Yeah,
small kids or whether they're
yeah,
adolescents, I think the issue with them in particular was really around the fact that their identity is still forming. And
yes,
so and unfortunately, this is a society that grounds value in doing.
yes,
It's what I do. What have I accomplished? What did I screw up? What did I mess up? And so then if the environment that you're in terms of school, gave you some means for success, whether it was academic, whether it's athletics, whether it's some combination, whether it was social, whatever that was,
mhm,
and those things that affirm your value, then you take that and remove it uh, from someone whose identity is not fully formed and grounded in doing instead of
mhm.
being, then I think that was a huge issue. I think the other issue, whether it was for the kids or even the adults, is of course being with um, people more often, like family,
Yes. How,
increases conflict, right?
yes.
Increases some people getting abused more, not
Right.
having more opportunities to seek help. You know what I mean?
Right.
Because they don't have privacy, they don't have opportunity.
Right. More
Um,
addictions, drinking to escape.
correct, correct. Again, because people don't necessarily have the proper tools. As I like to say, there's no permanent solution in a temporary fix.
Yes.
So you're not fixing what's really bothering you. You're not healing it. And on top of it, now you're adding on another problem because what you're doing is not the proper solution. And it's adding on another problem when you turn to, drugs and alcohol and, or any other kind of substance. So I think those were certainly some of the challenges, and I wanted to you actually segue into something you were talking about earlier, because I'm obviously a big proponent of integrative holistic approach,
Yes.
because again, we're not separate, right? The brain's
Right.
not separate from the rest of the body. We're not separate from the environment. We're impacting the environment is impacting us.
Right.
And I really don't think people sit down really consciously and think about those things as much as would benefit them.
Right.
And the reason I bring that up is because, like, for instance, if I tell people, if I take an orange seed and I plant it in the Antarctic, I shouldn't be surprised that it doesn't grow.
Right.
It's not the right environment,
Yeah, that's a really
right?
nice analogy.
Yeah,
Yes.
it's not the proper environment to give it what it needs for it to grow and to thrive. So there's nothing
Hmm.
necessarily wrong with the orange seed. It's just the wrong environment.
Right.
And
And
then
nothing, and nothing wrong with the environment.
correct in that instance. But
Yeah.
sometimes, when it comes to people, though, in the
Yes.
environments that we inhabit, the environment it needs some changing, right? It needs some
Right.
adjustments. So
Yes.
So I wanted to, because again, you and I think we're so similar in our mindedness, right?
Yes.
So I wanted to bring in, of course, the your use of, mindfulness and hypnosis, and just actually so people know, I've actually have used hypnosis and just recently went back to using hypnosis um, for weight loss, actually. And for
Okay.
me, yeah, for me, it definitely works. I've used it also in the past, and it has many benefits in fertility and many things. So you're talking about mindfulness, the hypnosis, and can we talk about that and
Yes, yes.
how you use it in your care of patients and its benefits?
Well, I'm thinking about your analogy with the orange seed and Antarctica, and it's not that either one of those spaces is bad or unhealthy. They just don't work together. So think about couples. And
Mm-hmm.
so I do a lot of couples work, and it's people are so quick to say, well, we're just, the marriage is dissolving because they're a horrible person. And oftentimes you just can't label it. They just are not, they're not great together. They don't bring out the best in each other. The orange seed will not grow with some people being together.
As I like to say, they're not a good fit.
Exactly. Yeah.
Yeah. My
They're not.
size, my size 11 foot will not fit a size 9 shoe.
Yes. Yes. So neither one of you are bad people. It's just not a great fit.
Right.
Yeah.
It's not the shoe. It's not
Yes.
my foot, just not a good fit.
Right.
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 And
So
even
that
all the
could,
11s don't fit.
yes, exactly. Or they don't fit perfectly, or you can get a callus.
Or some of them hurt, frankly. I'm talking about
Yes,
even
they
some
do.
11s. Like, well, you can stretch them. Well, no, I don't really do. So it's
Right.
just I'm saying that to say I absolutely agree with you. I think it would
Yes.
be so useful if people looked at it that way, that that you're discussing when it comes to themselves and partners or potential mates.
Yes.
So
And
yeah,
and
some
then
people are a good fit.
yeah, and even within themselves, judging their, past behaviors and, trying to let's say I just saw somebody this morning. He's an incredible guy, but was an addict a long time ago, but he's overcome it. He's worked really hard and he
Mhm.
still does daily. And
Okay.
he said, oftentimes I think to myself, I'm an imposter.
Mm.
If my team that worked for me really knew, you know, then they wouldn't see me as a leader. And I said I think there's a lot of shame there. And I think you need to love that part of yourself, incorporate that. That is who you are. That is part of who you are. It's not bad or good. It just is.
So do you use mindfulness with him or
Yeah, I do. So I do a lot of actually more informal hypnotic techniques, using certain verbiage. I don't necessarily have them lying on the couch and going through a whole I do with some people,
okay.
but I'll it's the way I use my voice. It's maybe what we've been talking about. Um, and I might use some interesting analogies. And then they come back
So
and
what is it? So for some folks, they don't necessarily know
yeah,
what mindfulness is. So
okay.
what is mindfulness and how does
So
it benefit one
yeah,
in the healing
so
process?
okay, so being mindful is being completely engaged your mind, body, and spirit. Takes a lot of practice because we are distracted all the time as human beings.
Mhm.
And so I think I learned mindfulness probably when I started yoga, because uh, you can't do poses and anything if you're looking around. So you've got to be on your mat. And I use that. I say to people, let's stay on your yoga mat. It's so it takes a lot of practice. So I teach people, I say, you don't have to do long, drawn out mindfulness meditations. Find yourself a little app. Sometimes they record me, and you can do it for 5 minutes. You can do it for 2 minutes. And just listen, stay focused, allow your body to relax and soften your face and feel, just experience it. And some people never do. I mean, a lot of people will say, most of us are crunched over our computer, so we're always feeling tense and we're not breathing properly. Our shoulders are not there. I mean, and so we're not mindful. We're just like little machines that are breaking down.
Uh-huh.
So yes, I try to teach very tiny baby steps and hope that they can work that into their daily life. So for example, I'll say, you get up in the morning, you set your tone for the day. How do you lead an anti-inflammatory lifestyle? It's kind of a mundane life, but how do you find joy?
What does that mean? And when I say, what does that mean? Why are you raising the issue of, in terms of an anti-inflammatory life? Of course, I know what you're getting at.
Right. Well, so you talked about the notion of fight and flight. Your sympathetic nervous system is on fire, and so your cortisol is going crazy. And if that's going on all of the time, and that could be good stress, or it could be positive or negative stress, actually. If you're just always excited and on and doing, you're going to burn yourself out. Causes inflammation on the brain and the entire body, and things start to break down. Cancer, you name it.
Right, because the inflammation is interfering with the body's normal functioning.
Yes.
Right. So that's what the importance of it. And
so I try to teach patients how do you lead that kind of a calm and peaceful lifestyle. It's a daily practice of small things. Getting up at the same time every morning. Don't just run out the door. If you can, take the 10 minutes, take some time to think about.
Dr. Gretchen, don't be outing me. Don't be outing me, Dr. Gretchen.
Now, some people, it works for them, like you, Dr. Boan, it works.
I don't know how well it's working. I know I'm doing it. I've been doing it for a long time, but I don't know if
but it's hard to do. Yes, absolutely. And I'm not suggesting this is an easy process, but all of these little components can help you lead a healthier life. Going to bed at the same time every night if you can. Really
and why is that important? And that's what I want to get into. So let me do this, and we're going to come back to why the importance of sleep and going to bed at the same time. The reason I specifically was asking about mindfulness, because again, I think for many people, it seems abstract, it seems woo-woo, it seems unscientific.
Yes.
And therefore, why should I do this? And to me, what I try to help people understand, and you've already talked about it, is that it's a means of placing yourself in your body. If I'm talking about myself personally, of me placing myself in my body and connecting to myself, my thoughts, my feelings, what's happening in my body. In a case of doing yoga, where my body is in space, because I do yoga also. It's extremely helpful to me.
Yes.
In terms of managing and helping with my stress. One of the things I know some people have difficulty doing, though, in the being sitting still, meditating kind of thing, mindfulness, is I tell them you can do a walking meditation, or anything can be a mindful activity. And one of my favorites is actually if I'm washing a dish, because and you can see, oh my gosh, it's such a wonderful experience, because I'm feeling the dish and the warm water and the soap, and there's all of these things in the experience that I miss when I'm not mindful, because I'm up in my head thinking about whatever it is I'm thinking about, but not the experience that I'm actually having. And so there's things there are things that I'm missing, positive, pleasurable, beneficial things that I'm missing in the experience, because I'm checked out and disconnected from the experience.
And I would guess too that when you're washing the dish, you're doing it very slowly, which helps you become more mindful. We're all so used to doing everything quickly. If you weren't mindful, you'd probably break the dish, which would be a symptom, or it would be telling you got to
So
move a little bit.
I think in the simplest terms, mindfulness is a way to connect to myself and the experience that I'm having in the moment, to fully immerse myself in the experience so that I
Yes,
fully get the benefits of the experience.
right. And so you kind of started to talk about the sleep thing, and that's the same idea. You don't just want to check out, you're watching TV on the computer, not engaged with yourself, and try to fall asleep.
Right. So what's the benefits of sleep, going to sleep, especially at the same time every night?
Well, you will get up at the same time. You will get the same amount of sleep. You will have a normal sleep cycle. It's it all works together. You'll feel better in the morning. Um, you think about when you're younger and you've got haphazard sleep and you don't realize how it affects you.
So, but
And
isn't
your body will start to tell you.
right, but isn't it also one of the benefits of sleep is that your mind gets to process things of the day and then
Yes.
gets to dump out some of the trash, as it were.
Right. So there are these proteins called amyloids that you want to, so right. So that's the time for the brain to cleanse. And
And
if
you know, and I'm just going to add this too, because you mentioned amyloid plaques, which people are connected to, Alzheimer's. Again,
yes,
to when you were talking about inflammation, again too, the problem with inflammation is that it damages body structures, it damages tissue. And when, of course, if it damages tissue, then that means it's not going to work properly. So you're trying to tell it, go to sleep the same time every night.
right. They have to have a dark room and you have to get your little mask if your room's not dark enough, and a nice cool room. And I just kind of describe it as winding down. I said, you've got this diurnal clock. And, back when we were,
What was
prehistoric,
the diurnal clock?
it's so in the morning you got all the energy. Oh, you don't have one? I think you did send me that email at 2 in the morning. Yours is a little off, but it's okay. It works for you. And
No,
that's the
I
other,
tell I
but
tell
that's important.
but how people say I'm a morning person. So I just it was talking to the chief, the CMO, and somebody else. And they, so I said, she's part surgeon, so she's like up wee hours of the morning. We have meetings at 7 a.m. at times once a month. And I said to her, I said, so she, she's part surgeon. I said, morning person, the morning person. I said, I'm a morning person too. I just prefer to go to sleep at 3 or 4 or 5 o'clock in
Oh
the morning.
God. But you see, but this is important information because for you, genetically, biologically, it works. You're able to function.
I'm going, can I just see
You know,
some patients at midnight or one?
right. You probably could
So,
in
so
Hawaii or something.
yes. So you were talking about the importance of going to sleep at a regular time.
Right, right. So, we talk about winding down, and that, I give I talk about, prehistoric times, you were forced to do that, right? You were forced to live by the environment. There were no lights there, you went to sleep and that's how you did it. But now we can be up doing day and night. You really would never have to sleep. And so how do you create that space so you lead a healthier lifestyle? It takes a lot of practice.
So what are I think of, again, what are, say, maybe three simple things that a person could do to help improve their mental health that doesn't involve medication. And I'm saying this slowly because one of the things that I always know to be true is that people are looking for, they tend to look for like the magic pill,
Right. The quick fix.
or the bullet, yeah, like the micro, I call it the instant grit fix, right?
Right. Right.
And you know and something that's got a whole lot of wow and pow and pizzazz, and and many things are very simple, but they also don't have a lot of flash or pizzazz, but they are things that if you do them and you do them consistently, that becomes your practice,
Yes.
that it can be very effective. And no, it's not the, the magic pill or the magic bullet or the magic anything. Um, uh, so but you do have to get in there and do them. So what are like maybe 3 simple things people could do?
Well, the overarching theme would be finding the beauty in a mundane life, finding peace and joy in slowing down.
Okay.
That's
Get
number
it, get
one.
it, get it. And what do you have some suggestions for? And I'm sorry, you said one, that was one thing. Did you have 2 others maybe?
So, trying something different, maybe that you've never thought of before. So instead of, I don't know, again, I think big changes are too dramatic for people. So, um, just turning off your computer at night once.
Okay, so you don't have to
You,
fly to Paris.
right, exactly. You don't exercise at all. Get up, at your desk. If you're at your desk, get up for, 5 minutes and do some marching in place.
Okay.
Little tiny changes will
And
lead to habits, better habits.
okay. And I was sitting up here thinking about this, and I'm like, oh, I want to make sure I get this in, which is, again, given the shortage of psychologists, um, and of course, we've already talked about, you said there's 19 prescribing psychologists in the state of Illinois. What are some ways that you would recommend for people to, find a psychologist in order to get the therapy that could be very beneficial for them changing their lives?
So, if you're using your insurance, always call your insurance provider and see, they'll give you a list of people in the area, and then maybe look them up and just see, are they a good fit for you? And that's the one thing I tell all my patients, if there's no relationship there, then move on. So
Mm-hmm.
you're consulting with the psychologist just as much, to see if you feel comfortable with them. And if you don't, there's no shame in that. Go on to the next provider. Um,
But I do advise people, because this comes up all the time. I
yeah,
do advise people that how you interact with your therapist is how you interact in your relationships.
right,
So if you have some concerns, don't just walk away from the relationship never having had the conversation. It's
right,
important to express whatever your concerns are and how you think your needs are not being met, so that they at least have an opportunity to do that. And
right,
again, it becomes a way for you to practice and learn valuable relationship skills with your therapist that you can then translate to other
yes,
relationships.
right. It's the microcosm, right? That whatever is going on between the two of you is typically how you do interact with others. So that's excellent. Yes, I would definitely agree with that.
So you said check your insurance
Check
and
your insurance. I mean, everybody, all psychologists today usually have some kind of a website or tell you a bit about themselves. Feel free to,
is it an association website that people could check too?
the Illinois Psychological Association does have a whole list, a directory.
Okay.
The Illinois Association for Prescribing Psychologists, we have a directory too.
Okay.
Um, yeah.
Ask friends and family that
And
that know
ask
that
your
has a
fam,
good therapist.
pardon me,
Ask friends
ask
and
your friends
family
and
that you know that has a good therapist.
yes, ask them, ask your primary care doctor, ask
Okay.
your psychiatrist.
Okay.
And
All right.
so again, it's word of mouth. Yeah.
So I want to thank you so much for being here with me and having these conversations. And the thing that I really want to emphasize, like I said, I was so excited to have the conversation with you today, because again, how I conceptualize the work that you do as a therapist and the work I do as a psychiatrist is, I tell people, if number one, if someone breaks your leg, they're responsible for breaking your leg, but because it's your leg, you're responsible for healing it. And if you don't know how to heal your leg, then you need to get help. And so and the average person, I don't think they feel shame about not knowing how to heal their broken leg. And so
Mhm.
that they should think about it the way they think, if their brain is not working function properly. I have a brain, but I'm not my brain, just like you have hands and you're not your hands. And
Right.
if you don't know how to heal it, there's no shame in it. Nobody knows how to do everything. Nobody, if you don't necessarily know how to fix your roof, your plumbing, you call somebody. So
Yes.
the way to think about a therapist then is, this is a person who has knowledge and informations and tools and training that I don't have. I don't know how to heal myself. Let me get someone who can help me the same way I would get someone to help me heal my broken leg, right? The doctor, the physical
Yes.
therapist, and whomever else is involved in that process. And
Right.
so the
A team.
right, right. But I'm saying, but even if it's just you in particular as a
Right.
therapist,
Yes.
seeing your therapist, they have knowledge and tools to help you heal past wounds, to help you learn how to look at yourself and ask questions. What am I thinking? How am I feeling? Helping you face your fears, helping you to transform your grief, right?
Yes.
And so that you're not stuck and that you can move forward and create the life you want. That's what a therapist does. They bring that knowledge and those skills to you to help, that you can then add to your toolkit to get the life that you want and not be stuck in a life you don't want. And there's no shame in that, right?
Right. And
There's
one of my favorite quotes that kind of ties that all up in a bow is, it's never too late to be what you might have been. You don't have to be stuck in whatever narrative that you have given yourself that creates pain.
correct. Correct. And because sometimes, so here's what I tell people. For me, in my belief system, again, we are the wonderfulness of the universe appearing as us, right? We're spiritual
Yes.
beings in a physical body. So who we are is already whole and perfect. That energy being is already whole and perfect. But
Yes.
some of our thinking is jacked up as hell.
It is.
It's
Right.
twisted, it's distorted, it's
It is.
sideways, it's all kinds of, needs some kind of, detangling, right?
Right. And it's
So
not like going in and doing a lube job on your heart. You've got to put some work into it. It's very challenging.
yes, so that's again the beauty of your talents, your skill set, in addition to the fact that you have the additional ability to prescribe for certain people that you think is important, and then refer them out.
Yes.
So I just real quickly, how can people get in touch with you?
Okay, so my website is drgretchenboules.com, DRGRETCHEN, B as in boy, OULES.com. My phone number is 630-321-9809. And as an aside, my partner, Dr. Boan, who's also a prescribing psychologist and neuropsychologist, we are going to be launching a telehealth platform. So hopefully we can help other people outside of the urban Chicago area. She's actually from Sandwich, and so she sees, a lot of rural patients. And so we thought that was a way to access, give access to people that are, not within our circle here in
Okay,
Chicago.
awesome, awesome. You on social media?
I'm working on that.
Okay, okay. All right,
Working on
all
that,
right.
yes.
All right. Well, you know what? Again, I just want to thank you for the work that you do, and thank you for um, having this conversation with me. To awaken and empower people, to
Oh,
help
well,
them to give them tools to heal and live their best life.
Well, I really appreciate and I'm so honored that you invited me here today. And again, thinking of energies, I was immediately drawn to you when I met you. And so obviously we've got very similar energy and I really appreciate it. You're
Yes.
lovely and so thank you.
Well, you know what? The same here. I have a great appreciation for you as well. I call women goddesses, divine feminine energy. So Dr. Goddess Gretchen Boules, thank you so much for appearing with me
Oh,
today.
thank
And
you.
it's been great. Thank you so much.
Thank you.
So I am your host, Dr. Valen A. Durr, awakening and empowering you to live out your infinite potential, to live life in the sweet spot. Thank you for joining us today in the sweet spot. Share, follow, and like us on social media. To learn more, please visit valinadurrmd.com, spelled BALINADURRMD.com. Join us next week, and remember, when you heal your mind, all things are possible.